Hello everyone, this is Chris. Hope everyone's doing well. Today's video, we're going to be looking at screening pulmonary function testing, our basic screen type of test which can be performed at the bedside or it can be performed in the pulmonary lab. So we'll take a look at some of the equipment and some of the basic maneuvers that are involved for a pre and post screening pulmonary function test or spirometry. Okay, so here are some of the basic supplies that the therapist will need to put together before going up to the patient's room or in the pulmonary lab as well. As you can see right here to the left, we have the Easy One spirometry, a very simple spirometry. It uses an ultrasound technology, so it's very reliable. Not a lot of daily calibrations that are needed like many of the other systems where you're using a calibrated syringe like a 1 liter or 3 liter syringe. These devices, once they're calibrated, hold their calibration for a really long period of time. Now also we have a set of nose clips, very essential for a screening pulmonary function test or spirometry, that we close off the patient's nose so that we can capture all of the volumes and flows that the patient's going to generate. In this case with the Easy One, we have a disposable mouthpiece, and then this flow tube here is essential. It is designed specifically for the Easy One and allows for that technology to measure volumes and flows very accurately. So that's the Easy One. Now let's go ahead and take a look at some of the software. All right, everyone, so that's the Easy One main menu. So when you turn the Easy One off with the, on with the on-off button here, you'll get that main screen there. And what we're going to be doing is performing a test. So you're going to push enter and you're going to select a new patient. As you can see, we can do a recall previous data, and you can do a quick maneuver, which would allow you to bypass the identification screens and go right to the maneuver in a pinch. Not too often used. I would rather have the data tagged with some identifier so it can be recalled from the database. So we're going to go ahead and push new here, and as you can see, we can enter an ID number in, so whatever that is from the patient's maybe their admitting paperwork or something on their ID number on their badge, a special identifier. So I'm just going to put 1, 2, 3 here. It has ability to add, I believe, 11 characters, so you have quite a bit of room to put that ID number in. And then we have a name that we can assert the patient's name. And again, these are multi-function keys. As you can see, each of the numbers, like for example, 8 has 3 possible letters. I'm going to push T for test. Then I'll go over here to E and hit that twice till we get the E. Come over here to let the number 7 and scroll through that until we get S, and then we'll go back to the 8 to get T. So we'll go ahead and name this patient test. And from here, we're going to go ahead and enter in the additional information, the age, the data, the height and weight. Here you can see you can put in the height in feet and drop that in very easily just by typing this information into the screen. And then we have the weight here. We can go ahead and put a weight in for the patient, whatever that is. You're probably going to want to use the most recent weight if the patient's admitted to the hospital. Then you're going to select the ethnic group, because the databases that are in the Easy One, as well as all the other pulmonary function machines out there, have different cultures, because there are some different values for different cultures. So you're going to want to make sure that you utilize the arrow keys here to select whatever ethnic group patient you're testing at that time. Male or female, again, use the arrow keys to select male or female. And then non-smoking is the question. Are they a smoker? Or yes, they are a smoker. And the diagnosis of asthma, is there asthma history, yes or no? And of course, at that point, the machine is ready to go. You've got a test identified, and you can select an FVC, just an expiratory maneuver, a forced vital capacity. You can do the flow volume loop, which is actually, I think, would be the better choice, because you're going to be looking at both a forced vital capacity and an inspiratory capacity. It looks at both and applies the graphic there to show you a normal flow volume loop. We've looked a lot at flow volume loop in other classes, and as you can see, we have a slow vital capacity that's available. We have a tidal flow volume loop and an MVV at the bottom. So I recommend using the flow volume loop there, inspiratory, expiratory, and an MVV to get a really good set of data, good spirometry, good simple screen type of a test. So that is the input screen with the EZ1. And we'll go ahead and show you each of these maneuvers. Yes, another question is asked once you make a selection. In this case, I selected flow volume loop. It wants to know the temperature. Temperature is required to calculate the data, as we recall in some of our other earlier classes. Very important that we document the temperature in which the EZ1 is being tested and which the patient is in that environment. And at that point, you can see it's going to be prompting you to block the flow tube, if you will. Put your thumb over the end of it here when it's placed into the unit, and that way it's basically it's doing a baseline, and then you can perform the test from there. Now again, for the flow tubes, these are disposable flow tubes. As you can see, it has an arrow here, and the arrow lines up with the arrow on the EZ1. So you just slide that in, and that will lock into place. And then you know that the flow tube is ready for a test. And then the mouthpiece, which is disposable as well, it's got a filter there. Make sure that we don't have any cross-contamination. That just is placed into the EZ1 flow tube here. And then at that point, you're ready. All you would need is your nose clips, and you can begin your maneuvers. Now, in the case of a pre-op patient, you would be doing most likely just a pre-test. But in many cases, the physician will order a screening pulmonary function test pre and post. So what that means is you'll be providing the patient with a bronchodilator. You would follow the hospital's policy and procedure on the test. Oftentimes it's just simple albuterol given after the pre-tests have been done. Give the albuterol treatment with a small volume nebulizer. I like to go ahead and take a history after the treatment has been performed, so that we can wait a little bit for the bronchodilator to take effect. I'll ask the patient their history, smoking history, history of pulmonary diseases, etc. Document that in the record, and then we can go to the post-test, perform the flow volume loop once again. Wouldn't necessarily need to do the MVV, however, follow whatever hospital policy and procedure dictates, and then you would do several post flow volume loops, put that into the database, and the test would be concluded. That at that point, all you would need to do would be to print the results and put them into the chart. All right, everybody, now with the information entered into the EZ1, we've selected a flow volume loop. Let me demonstrate what a flow volume looks like from a patient standpoint, the maneuver itself. So let me go ahead and put some nose clips on, and I'll perform a flow volume loop forced vital capacity. And of course, we're going to be breathing in maximal inspiratory breath in, and that will create our flow volume loop. So here we go. Maximal breath in. So that would be one maneuver. Obviously, we want to do several maneuvers. At least 3 would be best, so that we have plenty of data in the database for the system to determine which is the best effort. Always want to monitor your patient to see how they're tolerating this. Again, you don't have a lot of time. Patients do tire. They look at the patient's age. The older the patient, the more likely they're to become very tired after just several maneuvers. So just keep that in mind as you proceed through the testing menu. Next, we're going to demonstrate a MVV. All right, everybody, we're going to go ahead and demonstrate what an MVV looks like, and we'll do that right now. Again, nose clips placed on the nose. We're going to instruct the patient to breathe hard and fast, in it out as quickly as possible. And again, we could stop the test at any time. We definitely want to get at least 10 seconds if we can. Most patients will not last a minute, so you are going to end the test and the system will extrapolate that data over a minute. So here we go. Now, as you can see, that takes a lot of effort. Many patients will become dizzy, so make sure that they're sitting in a chair. You want them sitting at the end of the chair, standing straight or sitting straight up, so they have a good alignment with their thorax. But keep in mind, patients will become dizzy and they can have some difficulties, and you want to make sure that you're keeping your patient safe when you're doing any of these maneuvers, but particularly the MVV. Okay, so now that the maneuvers have been completed and it's time to print the report with the Easy One, you simply use the main menu and come down to the print results, hit enter. It's going to ask you if it's a single test or a date range where you can print, let's see, all the tests for a particular day. We're going to do a single report. Now in this case, we're just going to utilize the search function here that shows the last test that we did, which was the last one that we inputted into the database, and we'll select that one there. And of course, we can verify that indeed that is our patient there, and select enter again. And at that point, what the Easy One requires is that the device is placed into a cradle, the cradle that comes with the device here. And that device is connected to a printer, and it will automatically print the results to regular paper. And when we come over here to an example of what the Easy One report looks like, that is our pre and post. On the left is the pre-test blue flow volume loop, and on the right you can see the post test in red. And on the bottom here, you see the varying flow rates for each trial or each maneuver that was performed. Then we can come into some statistics here. There's some more data and detail on the report of percentages that the doctor would use to interpret the results and document their interpretation in the patient record.